Neurology quiz number 57. What is the SMART stroke-like migraine attacks after radiation therapy syndrome? This is a rare condition that can manifest years after cranial radiation therapy. It is characterized by migraine-type headaches, stroke-like deficits, seizures, and MRI abnormalities. It occurs most often in patients who have received more than 50 grays of total cranial irradiation. Clinically, patients present with migraine-like headaches, seizures, and focal stroke-like neurological deficits. Characteristic MR imaging findings include unilateral gyriform enhancement and thickening. These imaging findings can occur anywhere in the brain but have been described more commonly in the parietal and occipital lobes. These two images show a left temporal occipital region gyral enhancement in a case of SMART syndrome. Diagnostic criteria that have been proposed include the following: a remote history of external beam cranial irradiation without evidence of residual or recurrent neoplasm, prolonged reversible signs and symptoms referable to a unilateral cortical region beginning years after radiation, and manifestations include hemiparesis, hemisensory loss, visuospatial deficits, as well as seizures and antecedent migraine without aura starting after irradiation. Transient diffuse unilateral cortical gadolinium enhancement of cerebral gyri sparing the white matter and within the previous radiation field, and finally not attributable to another disorder. Pathogenesis. It has been postulated that the syndrome may represent radiation-induced vasculopathy. This leads to disruption of the blood-brain barrier, causing cerebral hyperexcitability and impairment of autoregulation. It is a diagnosis of exclusion, and tumor recurrence, stroke, etc. needs to be excluded. Treatment is supportive. Anti-epileptic drugs are given for seizures. Other medications that have been used include antiplatelet agents, migraine medications, and verapamil. Although attacks are reversible, SMART episodes can recur and result in permanent neurologic and imaging sequelae.